Welcome back to The Edge, the talk show that's by women, for women, and about women, and lots of really neat guys. I have a special neat guy with me today, Dr. McCollough, and talk to us about your plastic surgery clinic. What do you have to offer?
Well, thank you, Donna. We have a plastic surgery center, a plastic surgery clinic in Gulf Shores, Alabama. I lived in Birmingham for 35 years and had a big clinic there, and a few years ago I sold it and thought I was going to retire. And I realized that I was not ready for retirement. So we moved to Gulf Shores, and I built a large plastic surgery center there. And in addition to plastic surgery, we offer a lot of things that can help people look better, feel better, perform better, and live longer.
Okay, and I'm going to be talking with him about getting something done right here. So you'll be seeing some befores and afters with us. And then also you're associated with the clinic, and tell us what you do there.
We also have a consumer information center. We have several, and one's just opened up here in Birmingham, which would be the closest to you. And we do consultations there. We can do as little from just answering, questions that consumers have. They're so misled these days, and there's so much in the media. We can do as little as answering questions or everything up and until taking pictures and actually getting you some quotes. So we do a lot.
Gee, I have a friend who has actually had surgery done at your clinic, and she spoke nothing but high praises of your whole clinic and everything you do. It's such a relaxed atmosphere, and of course you're very, very good at what you do. Everyone I have spoken to has been
Thank you. I really enjoy what I do. I love what I do, and it's fun to go to work every day. I've got a wonderful staff of people, and what I am in is really a fun type of practice because we work with well people and we help people feel better about themselves. And so it is truly a fun type of practice to see someone who's concerned about a portion of their body, a part of their body, and then to be able to correct that, and then to see them become much happier with themselves. And we get involved in our patients' life, and we try to help them in more ways than just with surgery. We try to also look at their nutrition and their weight balancing and to make them feel better as well as look better.
Now, I know there are some before procedures you do before the surgery. How important is that the person does exactly what you say to do?
Very important. Because this is elective surgery, the very first thing we do is to make sure that the patient is in good health and that they're doing the surgeries for the right reasons. So we do a fairly extensive medical workup on everybody prior to surgery. We get a medical clearance from their physician. Then we do laboratory work. We give them a series of recommendations of things that they need to do and not to do. For example, you can reduce the amount of swelling and bruising that occurs following surgery if you stay away from aspirin, vitamin E, high doses of vitamin E, herbal teas, and some of the things that
So if a person is taking a vitamin E supplement, they really should not take that 2 weeks prior to surgery.
The amount of vitamin E that's in your multivitamin is usually okay, but many people will take 400 or 1,000 units of vitamin E in addition to that. All of those things are good for us because they tend to thin our blood and prevent heart attacks and strokes, but they also make you bruise a little bit more at the time of surgery. So if you do everything you're supposed to do leading up to the surgery and follow the directions, the instructions right after surgery, then chances are you're going to get along pretty well and be right back into your normal routine fairly quickly.
Well, I'll have to tell you, you help women feel beautiful on the inside as well as the outside. And one of my friends had your surgery. I had no idea. I think it was about 2 weeks after the surgery, and she looked really good. I didn't see the swelling you would have expected or the bruising.
I've spent most of my career not only trying to improve the techniques themselves, but to make the surgery as pleasant and convenient for people as possible so that they can get back into their normal routine. You know, a lot of the makeovers that you see on TV, people don't realize that those patients are 6 weeks out of surgery before they come back and have their reveal party. Well, a lot of people can't take 6 weeks out of their lives, and ordinarily within 10 days or 2 weeks our patients are back doing most of the things that they were able to do prior to the operation.
That's really good. So you have a consultation with also the family members?
Oftentimes, and I encourage the patient to bring their family members with them, particularly a husband and wife, because it's very difficult to remember everything that you need to know and to be able to go back home and repeat that to the person who's going to be involved in the process with you. So I encourage them to come along with it. Now, we also provide a tremendous amount of information for patients prior to surgery, probably more than most plastic surgery centers do. We have a book. The book is called The Image in the Mirror. It's a free book. Anybody can get it if they'll contact us and call one of our consumer information centers, or you can go on the web The book is actually on the web. You can download the book on the web
I
itself.
downloaded that, and I read part of the book last night.
Good.
Very
and
interesting.
it tells you a lot about the procedures, tells you about the anesthesia. All of the postoperative instructions are printed in the book. So even before the operation, a person knows how to plan for the aftercare. And I think that's extremely important, and one of the reasons why we have opened the series of consumer information centers for plastic surgery. I know that during an average week, people come in to see me, and the types of questions that they're asking during the consultation tells me that by and large the public is grossly misinformed. There's an awful lot of hype out there.
What are some of the questions your patients do ask?
Well, they come in asking about procedures that they saw on television, for the Oprah show, or on a special on the Today Show, or something like that. And it's somebody promoting a given procedure or a given technique. And many times these procedures are not proven. Sometimes they're not very long lasting. Some of them, the safety and the effectiveness of them has not been proven. And the products that are being recommended, I'm a little bit concerned about some of those as well. So we find that the patients who come in are confused, and we decided that in order to try to help this problem, we would open up a series of consumer information centers. We have one in, of course, Gulf Shores, where the clinic is. We have one in Pensacola, Gulf Breeze, one in Destin. We have one in Birmingham. We just opened Biloxi, Mississippi, and then Tuscaloosa and Montgomery, and probably Huntsville in the very near future, and maybe Anniston, Jacksonville. So we're going to go to the public and provide them with factual information that they can use to determine whether or not surgery is right for them.
Why would a person not have the surgery?
Well, there are a couple of reasons. Number one, if a person's not in good health. If they're not in good health, we don't recommend elective cosmetic surgery. Number two, if they're doing the surgery for the wrong reasons. Some people think that plastic surgery might retrieve or save a failing marriage, or it might ensure a promotion at work, and it doesn't always do that. If a person feels better about themselves, that's a good reason to do it. So really the questions or the answers that we want to hear when we're talking to a person is, I really just want to look as good as I feel. That's the right reason.
That's
to
the
have
right
surgery.
answer.
That's the right answer, yes.
Okay, now we talked about some of the questions people may have. What are some of the questions you would ask, say, the husband of a wife having the surgery performed?
Well, first of all, I like to know from the husband or the wife, depending upon which one the